all studies with antibodies were performed to last 1 year and a half, or a little bit shorter. There is no much patients who got the treatment after 1 year and a half. Maybe the time is not the best framework, because clinically you also use how much reduction in amyloid load in the brain with PET was done. Of course, PET is quite expensive, so to follow up with PET, maybe in clinical reality, you will use some proxy, for example, phospho-tau from the blood. So 1 year and a half, but the question is also how you stop the treatment, when it's time to stop. This criteria to stop the treatment should be a little bit better explained. Today we don't have it, as I said, approved in Europe. Only my colleagues from the US that we discuss how they stop. So usually in clinical trial setting or in university setting or very good memory clinics, you look not so much on the time, but what is the amyloid load in the brain. But I said you cannot stop the treatment over one night. After 1 year and a half, it will be difficult that you say because there is no study. So I think also that we have a potential when we start to treat patients to combine this with registry-based study. So we can see what happened after 1 year and a half for our patients. So this should not be really the day, 1 year and a half. It should be more flexible, maybe some other clinical criteria. But of course, studies were done. So according the evidence, we have evidence to 1 year and a half. But what's next? It's difficult to, when you find the patient to fulfill criteria, how you stop the treatment and what happens. So our role can be that we can contribute to the science to be able to give the registry-based studies.